All right, now that's taken care of there. So I'd like to welcome everyone to the Psychosocial Issues and Diabetes webinar. This is webinar number 5 of 6 in a new pilot program for the CDA. We've done 5, like I said, 5, so we've done 4 previous topics. We've been doing these webinars about every month, so every second Thursday or third Thursday of the month. And again, this is number 5, so there's one more next month, and I'll remind you guys at the end about that one. They're recorded, they're all put on YouTube, so you'll be able to check some of the previous ones out that we do have. Today's topic, psychosocial issues and diabetes. We hope the webinar will introduce you to new topics or generate some discussion around some of these issues, right? So psychosocial issues can sometimes be one of those things, either a touchy subject or a subject that isn't really explored all that often. So that's kind of the idea here. My name is Russell Thompson. I am presenting today. I'm also blessed with being the Public Programs and Services Coordinator for Southern Alberta. This is me here in the cowboy hat. I've also taken this name of the Diabetes Cowboy. I live in Calgary. I have a Bachelor of Arts in Psychology, a minor in Leisure Studies from the University of Ottawa. I do have experience in this field, sort of a small experience, but it is experience there. I've done some mental health work with youth and things like that. So this is a topic that is close to my heart, and something I'm really passionate about. I've been type 1 diabetic for 12 years now. 13 years in July. I'm wearing a pump and occasionally a CGM when everything works through. A bit of a disclaimer before I go any further. Again, I'm not a professional. I'm not a professional at anything, so I don't have any of those qualifications or anything like that, but like I said, I do have experience in the field of psychology, so hopefully we can uncover some of these issues. So just to overview, we'll look at the relationship between sort of the medical world, diabetes management, and the psychological factors that surround both of these, or how they play out together. We'll look at what happens when one breaks down, right? So what does that look like? And of course, towards the end, looking at the importance of that, right? Here we go. So yeah, this is how I kind of like to visualize it. Obviously, we have this medical realm, the psychological realm, and the diabetes management. So they kind of all play off of each other, right? They're kind of this either triangle or spinning circle here of topics. When one falls or when one is affected, the others also fall, and the others also are affected, right? So they do play off each other. They're intertwined, about a third each, right? So I'll go into a little bit of detail about each one now. So the medical realm. This is your relationship with your healthcare team, right? Your nurse, your dietitian, your endocrinologist, looking at you as a third party, perhaps, just saying, well, you look physically fit. And, as type 1 diabetics, we might get this from the public, right? You don't look like you have diabetes, or you don't, it doesn't appear that you have diabetes. And physical health for doctors, nurses, it's sometimes the easiest to measure, right? And by that I mean, it's easy to look at blood work. It's easy to look at the numbers, the A1Cs, cholesterol, whatever it may be, and say, you look physically fit at your body, right, kind of thing. This sort of relationship, sorry, let me rewind here. Healthcare team with your nurse, your dietitian, your endocrinologist, possibly, with your social worker or psychologist if you have one, right? So, that kind of plays in there as well. Physical health does have a relationship with psychological health. For instance, increased stress can cause back pain, neck pain, things like that. We know that this is a symptom of stress, right? So keep that in mind as we move forward. That's the sort of outline of the medical realm or medical side. So the diabetes management side. Here we have, carb counting, the daily routine of diabetes, right? We're looking at diet, exercise, BG testing. The professionals might call this, or your endocrinologist might call this the behavioral category, or how you act around your diabetes. It's what we do, or to another extent, what we don't do, right? We know we all have different definitions of diabetes management and what that looks like, right? So whether it's testing 3 to 4 times a day for someone, or whether it's testing 9 to 10 times a day, it's different per person, right? A lot of people get caught up in being the perfect person with diabetes. They're looking at this ideation of perfection, right? This idea that, it's trying to be the best versus trying to get by, which might be, the adequate diabetes care, or, not trying at all in your diabetes, right? An analogy I like to use is it's difficult for some people, for example, if you're studying for an exam, and, you and a friend are, both studying for it, your friend might put 2 hours into it and, might get a 90% on the exam versus you who might put in, 6 hours and only get 75% on the exam. The idea of, how much effort or how much work we put into it, for this result might not be the case, right? So that's kind of the diabetes aspect, and, going back to that perfection, right? The idea that, I have to be the perfect person with diabetes, or this idea of, always trying to strive for that, hitting perfection, right? And that's sort of the diabetes management side of things. The next is the psychological, or that third side, right? So we have feelings and attitudes towards diabetes. There are external and internal factors. External factors are uncontrollable, right? So those are the more psychological factors. Those are the internal diabetes environment, right? For example, you would be able to test, but not necessarily the result is controllable, right? You might do something completely normal, or have a day that's completely normal. Test your blood sugar, and you might be a little high or whatever it may be, and you've done everything right, or you've done in your mind you've done everything to be perfect, right? And it's kind of that idea that you can't really control your blood sugar all the time. If you even if you have all your factors in line, sometimes it just gets out of hand, right? Yeah, we all have days where we might test 4 to 5 times, 20 times, whatever it may be, and you still might end up high or low, right? For the psychological realm here, it's often the hardest variable to measure. In psychology, there's a lot of self-report, a lot of questions, as a basic example, how are you doing? And they're very hard to kind of ask and get a picture of it, right? And these have always been the tough questions in psychology, and they surround these topics, right? Stress, depression, anxiety, confidence, and burnout, right? And how do we measure those? How are they really looked at? And they can be quite difficult to answer. So what happens when one of these fails? In my experience, there's sort of 3 reactions, right? We have sort of the neutral or ignore. This idea that sort of nothing happens, there's no change in your daily routine. If psychology goes through the psychological side, or get super anxious, or the doctors aren't there. So there's sometimes this neutral reaction. You might be motivated to change, right? Change your testing regimen, eating healthier, exercising more, more carb counting, or bolusing before eating. These small little details, maybe motivate you to change, or motivate you to get a better A1C, or whatever it may be. In my experience, for me as a type 1, I'm more aggressive and motivated to change something when I get dealt some of these cards, and I want to attack that. I want to be proactive and get out there and change, and I'm very motivated by those physical aspects, or whatever it may be, that A1C, for instance. It feels good when you're motivated for change. It feels good when you get it right, or when you're working towards that goal, right? And then, of course, there's the dreaded diabetes burnout, where you ignore diabetes, or you regress to this comfortable zone. It might obviously be associated with guilt, something like, yeah, I know I could be doing this, carb counting to a T, or again, bolusing before eating is a big thing. Diabetes burnout, it's usually associated with a phase, right? So we have a short and a long phase, right? An acute or chronic sort of phase of diabetes burnout. And that's where you can get things like leading to depression, right? If other things are mounting and building, especially in this diabetes, especially in living with diabetes. It's a 24-hour, 7-day-a-week job, right? So these things can definitely come of it. And again, they're often the hardest to measure. They're often the toughest to look at, right? And I just want to put a note onto the depression, right? I've always been I've always looked at depression as a feeling, right? It's like being sad or happy. Obviously, longer and chronic feelings of depression can be a problem, right? That's where we get, into other things. Highly suggest talking to a professional, right? Someone like a social worker, someone like a psychologist, right? They're the ones that can help either lift you through those moments or whatever the case may be, right? Again, stress, anxiety, those types of ideas, right? All right, so now let's look at diabetes burnout, because that's the fun one. Diabetes burnout sort of has three different ways, right? Three different ways, or again, these realms, these ideals. For instance, a personal barrier would be health beliefs, right? A lot of type 1s, maybe in your younger years, you felt invincible, right? This won't happen, complications won't affect me, blah, blah, blah. That type of idea. Fears, right? Fears of highs or lows. I know, when I leave the house, sometimes that's the last thing in the back of my head is, will I go low? What do I need to carry on me, right? Those types of things. And negative feelings towards health, right? Just, personal views. That could be a reason as well, a personal barrier or a personal contributor, to diabetes burnout. There are a lot of interpersonal barriers, right? Family, for instance. So, are your parents nagging you? Are your, siblings on your case? Spouse, whatever it may be. Social situations, right? I've talked to a lot of peers that if they're out at a restaurant, they don't want to get up from the table and go inject in the bathroom. And that can certainly lead to diabetes burnout. Just, again, not paying attention or just ignoring the diabetes side of it, right? Just, yeah. And environmental barriers are a big one. Cost. Cost is huge for people with diabetes. It's a very expensive thing. I'll be the first one to admit, and I'm sure there's a lot of other people who can sympathize with me there. And we all kind of, diabetes burnout's normal. We all kind of, sometimes we get this feeling. We know this feeling. It's the womp womp or here it comes kind of thing. Physical symptoms, slouched, slow moving, whatever it may be. For me, again, diabetes burnout is when I take those days off or whatever it may be, my mood is often grumpy, upset, irritable, and that's where, you get those other people asking questions, are you all right? And again, that's just another trigger for you to set off, right? So it's one of those adding pieces, right? Diabetes has a lot of different components, obviously, as you all know, and again, just another analogy. It's for people with diabetes, it's like an equation, right? It's balancing this equation for whatever reason, one equals one, and for diabetes, there just seems to be so much more adding to that equation, right? There's y, x, z, whatever it is, minus 2 plus 1. It's just all of the things that go into this equation, right? Yeah. Depressed might be the mood, even though diabetes is more to do with ignorance rather than depression. Just a note there. Often associated with depression, depression is with burnout, negative feelings, guilt, things like that, right? And just a note, the source that I got it from, Polinsky, it's about 1999, so they're not the freshest, but I kind of drive them up a little bit for 2014, I guess. That's about 15 years. 15 years, yeah. The math's not the greatest. So moving on to coping. Here's a little picture of me playing hockey, and I'll get to that in a minute. So diabetes, burnout hits you kind of thing. What can we do? Well, we cope, right? As people with diabetes, we cope. And that's kind of, it's whatever makes you happy. Obviously, keeping in mind one thing, and that's not to be negligent of your diabetes. It has to be there. It has to be about one thing, and it's about balance, right? Balancing diabetes with the rest. It's that equation piece. If you're at work or whatever it may be, or whenever burnout hits you, take a break. Mentally check out just once in a while, 10 minutes, whatever it may be. That's something that helps you on a sort of short-term level, I guess. And then, as the example, sort of a bigger coping mechanism, I'll use hockey, right? Hockey is something that, I have to think about diabetes before I go on the ice and after I come off the ice, right? And I do that because I want to make hockey enjoyable. I want the experience to be enjoyable when I'm on the ice. One thing that hockey generally does for me is it makes me intrinsically happy. It's a physical game. My physical output's great. I have a sort of a religious devotion to the sport, if you will. I know that the Habs are playing the Bruins right now. I hope you guys are watching the game, maybe on mute. It's surrounded by these, either pre-game rituals or, it's excitement on game day, right? So when I'm playing, I have to keep my diabetes in check, and when I know I'm playing that night, I have to come up with a balanced attack throughout the day. I'm doing, a disservice to not only my team but myself if I neglect my diabetes that day or afterwards, right? And that's leading up to the game. And after the game, we know that, activity can sometimes, for certain people, either bring your blood sugar down afterwards or bring your blood sugar up, right? So it's thinking about diabetes before, after, and, even during. You got to be mindful of, when you go on the ice, what's it like? And I know certain people have different expectations of, activity, right? So they want their blood sugar to be here, X, Y, Z, whatever it may be. But it's about making that enjoyable for you, and hoping that it's enjoyable, right? Hockey is just my one example, and as people, we need to develop coping strategies. We need a toolbox of ideas to tackle stressful situations, whether they're external or internal, and hopefully those are positive, right? And I know it's not always great to. It's not always. It's easier said than done to say, have a positive mindset and think about positive things, but it's not always possible. I understand that. But just think, you can't build a house with a hammer. You need a shovel, you need nails, you need wood. Sure, you need the hammer, but you need other tools in this toolbox, other coping mechanisms to bring out during those stressful situations, right? Yeah. Okay. All right, so getting back on track, and here's another picture of me. I'm hiking somewhere in Kananaskis in that one. Getting back on track, like I said, burnout is normal. It's a part of diabetes. And, it's all about those attitudes, those feelings. The way I look at burnout is, it's so yesterday. And I know that sounds kind of cheesy, but, sure, maybe I allow myself a day or two off, whatever it may be. But the important part is that I get back on track. The important thing is that I'm picking my things up and I'm moving on. I'm focused on tomorrow, and I'm moving forward, right? An important note is, between these two pictures, right, between this picture and this picture here, what we see isn't everything. Here's an example. I'm hiking in, the backwoods of Kananaskis, wherever it may be. Just because it appears, I'm holding my pump, I'm smiling, holding up the number 1, whatever it may be, doesn't mean I'm coping or avoiding diabetes burnout at this time. It's just, it's another scenario. It's a scenario that could be made far worse if I was, in diabetes burnout here, right? I have to think to myself before I go on this sort of trip, if you will, where's the nearest medical attention, right? What if I go low? What if? You have to be prepared for those situations, right? And that's why I use this picture here. Again, it could be, right? It could be a sign of, who knows, diabetes burnout. But for me, hiking, nature, moving activity, it gets me back on track. It gets me in the game. It gets me in the saddle. I realize what I have when I'm in the backwoods of Kananaskis, and I'm being grateful for it, right? Very grateful that I'm able to do something like this. It's something that's quite wonderful. So something that we've all heard, or maybe some of you have heard, are these SMART goals, right? Specific, measurable, achievable, realistic, and timely. And I know I have a ... yawn here, but for me, I've heard these many times in my life. They are good for some people. Some people like to write their goals down and go from there. you know, for me, I'm a big personal believer of just getting out there and just doing it. Whether it's, organized or not, you know, tomorrow will always be tomorrow, but now is the perfect time if you're looking for change, right? Even if we're just looking at testing once a day, if you're not testing all the time, or, going for a walk if you want to start getting active and making a huge difference during exercise, right? I think the critical piece in this is to find motivation and stick to the plan. For example, if you want to test more, try, testing one extra time a day or whatever it may be. And just, again, finding that motivation, right? So knowing your resources, or as I have here, know you resources. So we're talking about knowing resources for when diabetes gets stressful or when diabetes gets too much, right? So we have family, friends, pets, even. The diabetes community has been a big one for me, and professionals, right? Social worker, registered psychologist, whatever it may be. Obviously, they're in no particular order, and everyone is different, right? So the list can change throughout life. It can go, diabetes community might be higher for someone, and family and friends might be lower for other people. It's just the way it is. One thing I do know, and again, this is from experience, is transitioning, whether early age, adolescent, teen, young adult, marriage, whether having children, whatever the life stage is or whatever the event is, the list will change for you, right? So family might become less important, diabetes community might be more important. It changes for everyone. And different life stages mean different resources may be available or not available. It's possible that, you can't talk to your family every day because they're just getting, either annoyed at you or whatever it may be. So, moving on to looking at friends, again, the diabetes community, turning to another resource that is available, right? All right, barriers to resources. So these are, as I mentioned, the barriers. As I mentioned, the resources. How can those resources be inaccessible or unaccessible? I guess you could say. Inaccessible is the word I'm looking for. So something like stigma, right? And this exists in many facets of type 1 diabetes. We've all heard this. There are a lot of things that someone with type 1 has to worry about, and the last thing, we need to hear is, my grandma has diabetes, right? The stigma exists in diabetes, but there's also a huge stigma with mental health, right? And we know that part. There's lots of work being done around the stigma piece and mental health, right? We have Bell Mental Health Day now. We have, mental health awareness campaigns popping up across the country. I think we got to look at these moments maybe as a teachable moment for some people, but the diabetes stigma is one thing, and then when you compound that with a mental health stigma as well, it's definitely, it becomes a huge barrier. It's not something people easily want to talk about, but it's quite possibly the most important. Time, for instance. Getting help or going to professional resources usually takes time and commitment, right? So, for instance, you might sit down with your endocrinologist or your nurse. They might set goals or go through your numbers, whatever it may be. You can walk out of there in 5 to 10 minutes with sort of a concrete plan, or either that motivation or that change or that sour experience, whatever it may be. But if you are seeing a social worker or psychologist, there's less outcome in that one meeting, right? 30 minutes, you got to put the work in, right? You got to really add to what. You got to really add to the appointment to make sure that you're going to get something out of it. And it's kind of like, again, another analogy. It's important to see it through, right? It's much like finishing, antibiotics, for instance. They always tell you to finish the bottle. Seeing a psychologist or seeing professional helps the same way. You have to finish, you make sure that you see everyone and you get everything sort of tied away with that person, right? So it's making sure you're putting the work in, not just once or twice, but making sure that, if they still want to see you, that you're going to those appointments and following up and things like that. And that's huge, right? And there we have it. This is my Twitter here, my Facebook, if anyone wants to like my page or follow me on Twitter. And then an email, if anyone wants to drop me an email, they're more than welcome to.